Hi, I'm Dr. Keith Volstad.
And I'm Laura McLeod Volstad of Volstad Chiropractic and Integrated Wellness. We're located at 275 Tony Penna Drive, Suite 12, right here in Jupiter. And our telephone number is 746-4242. We'd like to welcome you to this week's edition of the Chiropractic Corner, a weekly show spotlighting the chiropractic profession and what doctors of chiropractic do to improve their patients' health. In this program, Dr. Volstad and I plan to cover topics that pertain to your health from a complementary and alternative medicine point of view. These topics will include spinal injury issues like neck pain, low back pain, bulging discs, pinched nerves, and sports injuries, lifestyle medicine, dietary and nutritional advice, nutraceuticals, and supplementation, just to name a few. We'd like to encourage you to email us about topics that you'd like to hear discussed on this program. You can do that by emailing us at imchiro1 at gmail.com. That's M as in Mary, CHIRO, 1 at gmail.com. Since we've started the Chiropractic Corner, the emphasis of our shows have been on chiropractic care. As you know, chiropractic physicians are conservative management physicians who don't utilize drugs or surgery. As conservative management physicians, chiropractic physicians are categorized as alternative physicians, and as such have been promoting wellness care for decades. There's an emerging field in healthcare that has a lot in common with chiropractic. It's an alternative or wellness care healthcare system. That emerging field is functional medicine. For the sake of our listeners, Doc, can you tell us what functional medicine is?
I'd be glad to. Functional medicine as a healthcare system addresses the underlying causes of disease using a systems-oriented approach to find the root cause of the patient's health issue.
What do you mean, a systems-oriented approach, Doc?
It means the way in which a doctor evaluates the patient is systematic. Mm-hmm. That is, following a step-by-step approach. For example, step 1 is history taking. Step 2 might be examination. Mm-hmm. Step 3 might be diagnostic imaging, and so on. It's very similar to what most patients are used to when they go to see the doctor today.
Makes sense.
Yeah, it does. Now, functional medicine engages both the patient and the physician in a partnership, a therapeutic partnership. Mm-hmm. Instead of the doctor being the primary motivator in the patient's recovery, functional medicine promotes a team effort. The patient takes on quite a bit of responsibility for their own recovery, with the doctor then providing the therapeutic input. Functional medicine changes the focus from disease orientation to patient-centered orientation. And so, by shifting the traditional disease-centered focus of the modern medical practice to a more patient-centered approach, functional medicine addresses the whole person, not just an isolated set of symptoms. Functional medicine physicians spend time with their patients, listening to their stories, learning about their lives, and looking at the interaction between their genetic, environmental, and lifestyle factors. And that these things then can influence their long-term health, mm-hmm. and then how the interaction of these can create the complex chronic disease states that we're seeing today. Then we put together an individualized treatment plan to address these individual or unique set of circumstances that presents as the patient's condition. In this way, functional medicine then supports the unique expression of health and a person's vitality on an individualized basis. It's an evolutionary change in the practice of healthcare. And this change, in my opinion, better addresses the healthcare needs of patients in the 21st century.
That's an interesting change in attitude and practice of medicine, Doc. But as interesting as it may be as a topic, let's bring it to a real level. Why would a person need or want to look into functional medicine versus what I'll call conventional Western healthcare?
I think your question, Laura, gets to the heart of the issue that we face in healthcare today. Now, I realize that some of the things that I may be discussing are going to fly in the face of what we have been taught our entire life. Some of the comments that I make may be controversial, but I think in the face of what we're looking at today as far as chronic disease is concerned, I think you're going to find that it makes a lot of sense. Mm-hmm. Those issues, then, of the chronic disease states, those issues are exploding today. I'm talking about disease states like heart disease, diabetes, autoimmune disorders like SLE, multiple sclerosis, psoriasis, things along that line. And I would include in that hypothyroidism as well. How many of our listeners have said or heard an acquaintance or family member complain about not really getting any better?
Yeah, a lot.
Complaining about their condition not improving and saying things like, all I do is take pills and I don't seem to be getting any better. Mm-hmm. The healthcare system of today is the world's best when it comes to acute conditions like fractures, strokes, heart attacks, and trauma. Right. You know what I mean. Urgent care that has to be done right now or the person may die.
Of course.
What the present system doesn't do well, in my opinion, is the treatment of chronic conditions like the ones I mentioned a few minutes ago. And I believe there's a reason for that. The present system is geared towards looking for a cadre of symptoms, then identifying a disease entity or diagnosis based on those symptoms, and then treating the symptoms/diagnosis with drugs or surgery.
But that doesn't work with chronic diseases? This idea of identifying a diagnosis based on symptoms doesn't work with chronic disease?
Unfortunately, the disease/symptom-centered approach to medicine lacks the proper methods and or tools for preventing and treating complex chronic diseases.
Why?
In many cases, this conventional medicine approach doesn't take into account, for example, the genetic makeup of the individual or other factors such as environmental exposure to toxins like we may find in what we eat. There are many aspects of today's lifestyle that have a direct influence on the rise of chronic disease in modern Western society, and the necessary discussions about these lifestyle choices aren't had. Think about this. How many times have you gone to your primary care and have talked with him or her, and I mean really talked with them about your diet or other lifestyle issues?
Yeah, not much, if at all. I see what you mean. So often the visit's very direct and to the point about the condition at hand. It doesn't stray very often into lifestyle issues. I guess there's precious little time for that.
You're right. You're absolutely right. And I would imagine our listeners out there could count on their fingers the number of times they have discussed in detail their diets and other lifestyle issues that can contribute to the development of chronic disease conditions. I'm sure there are discussions about diet, etc., but I would imagine, for the most part, they're pretty cursory and very shallow. There's no offense here towards my medical brothers. But with the patient load that is seen in many of the conventional medical offices, as you just said, there just isn't time to go into things like that. I believe that is one of the huge, and I do mean huge, problems with the present healthcare system. And lastly, I don't believe that most conventional medical practitioners have the necessary training to assess the underlying causes of complex chronic disease and then to apply strategies such as nutrition, diet, and exercise to both treat and prevent these illnesses in their patients.
Some pretty strong words there, partner.
You're right, partner. But how much nutrition and dietary management is taught in medical school? If you look at their curriculum and at their course catalogs, there's not much there. Their training is in the diagnosis and treatment of the acute patient rather than the chronic one. But that's where functional medicine physicians can step in and fill the void. Interestingly, though, research into this field is exploding. There are tons of abstracts and articles on PubMed dealing with research that's...
up there. Doctor speak alert.
Okay.
Sorry. What in the Sam Hill is a PubMed? Sounds like a place you go on vacation.
PubMed. Okay. PubMed is an online collection of research abstracts and articles that are available to anyone who wants to read or needs to read them. Many of the studies done today by researchers will be uploaded to PubMed. They will upload their abstracts or their articles so that anyone interested can read them. Also, many of the scientific journals will make their articles available on PubMed as well, so that anyone who's interested can find the specific article related to an area that they're interested in researching or doing some study on.
So it's like a doctor research paper website.
Yeah, I guess that would be a way of understanding it.
Oh, okay.
All right.
Thank you.
Well, getting back to the discussion, there are tons of articles and abstracts on PubMed dealing with research that's going on in the evaluation, diagnoses, and treatment of chronic conditions with natural remedies, such as nutraceuticals and dietary management.
I understand what you're saying, but can you give our listeners a better visual understanding of the difference between conventional Western medicine and functional medicine?
Well, that's a great idea, Laura, and I think I have just the thing.
Good.
Think of a tree.
I like trees.
You would. How do you know a tree isn't doing well? How do you know it's sick? Well, you can very often see it in the branches and the leaves, right?
Right.
In order to keep a tree healthy and allow it to flourish, you need to support the most basic and essential elements first. That's the foundation. And that foundation is the roots and the soil.
Right.
If a tree's not healthy, isn't the first place you look for answers in these foundational elements? As a landscape design artist, you know this better than I do.
Yep, we see it all the time. For example, in the gardenias where the leaves are yellowing, and that's the telltale sign it needs fertilizer, an acid one in particular. Or your coffee grounds. Wouldn't it be nice if it was easy to see in people?
Exactly. You can tell by the leaves and the branches that those plants aren't doing well. And the gardenia is such a pretty flower.
It is. Smells wonderful. It's that spring bloomer. It's the harbinger of spring here.
That's it, and it smells wonderful. You're right. But it's the same as with patient care. We can use the same analogy. In functional medicine, the same approach applies. The most important factors, and the ones we examine first when gathering information about the patient, are the foundational lifestyle factors. Things like sleep, exercise, nutrition, stress levels, relationships, and genetics. These are like the patient's roots and soil. Problems with these areas can and usually will eventually result in the signs and symptoms that are grouped together into a diagnosable array that's called disease. Like in the tree, when the branches and leaves demonstrate the imbalances, the human body is the same. When the imbalances occur, they manifest themselves as symptoms that the doctor then can look at and find. However, the problem isn't in the branches and the leaves in the tree. It's also not in the symptoms in the patient. It's in the root and the soil, and that's what needs to be addressed. Conventional medicine attends to the branches and the leaves with their treatment plans, whereas functional medicine physicians attend to the roots and the soil.
Okay, you're singing my song with plant material analogies. I sure get it, and I hope our listeners did too. Now, let's be specific. What's the difference in real terms between conventional Western medicine and functional medicine?
Well, to begin with, the focus of care is different. The goal of conventional Western medicine is for the doctor to identify disease by recognizing these patterns of symptoms, and then to treat those symptoms by prescribing drug-based therapies or maybe even surgery. Very commonly, those drug-based therapies are similar for all the patients with that specific given disease. For example, patients that may have a migraine headache, they'll all get a certain pain reliever for that headache. It's always the same prescription for that type of headache. Notice, though, what I've just commented about, that the words patient and health do not appear in this description, but the words symptoms and disease do. Now, the goal of functional medicine is to promote health and vitality in each patient on an individualized basis. Not to say that the conventional Western medicine's doctors don't want their patients to be healthy and to have vitality, but I'm just saying that the approach to their care is different. Functional medicine practitioners will examine the patient's lifestyle, including things like diet, sleep, and stress, just to name a few. They'll also look at unique biochemical factors, as well as evaluate the genetic information of each individual patient to identify an underlying cause of their disease and then to find treatments that help return patients to optimum health.
Well, that's going to be a long conversation.
It is a long conversation.
Or could be, for sure.
Sure, and we talked about that earlier, that functional practitioners tend to spend a lot more time with their patients than the conventional Western physician will. It's important to note that even though the patient may have a similar diagnosis as the other patient, the treatment protocol may be significantly different because the underlying cause is different. And getting back to that migraine headache example I gave a second ago, the treatment from a functional practitioner may be vastly different from patient 1 with a migraine to patient 2 with a migraine, because there are quite a few differences in the root and soil issues that patient may present. And those are the things that we want to correct.
Okay, that's one difference. Are there any more?
Yep. Another difference is that conventional Western medicine is highly specialized.
No, that's true.
You have neurologists, dermatologists, orthopedists, endocrinologists, and all kinds of ologists. The patient is divided into parts, and each specialist has his or her own area that they look at.
Right.
The functional medicine practitioner is holistic in his approach. So he looks at the body as a whole, not piecemeal. Very often, the patient's condition will involve several systems in the body, and they all have to be addressed together for the patient to recover their health and vitality. Another difference, since you asked, is that functional medicine is actually patient interactive. We commented about this before. The patient is actively involved in their own health care. In functional medicine, this is a team effort.
In what way? What does a patient need to do?
Yep. The patient is expected, and really we kind of require the patient to actively participate in their return to health. Compliance is a huge, huge factor in functional medicine. As such, then, the patient can be in charge of their own outcomes. They can control how they respond and recover. They're also in charge of the restoration of their own health. So if they comply and they are actively involved, generally the outcomes are much more positive. And there's one more difference that I think I need to mention. Functional medicine is very cost effective. It focuses on the prevention of disease. The promoting of lifestyle changes and sustainable treatments that address the underlying causes of dysfunction, restoring patients to health. Conventional medical treatments are often more expensive, like, expensive medications that must be taken almost indefinitely, and most often do not address the underlying problem, but merely suppress the symptoms. How many times have we heard in the office patients talking about taking high blood pressure medicine for, years? I've been taking high blood pressure medicine, doc, for 20 years.
Yeah.
And a lot of times all they're doing is just suppressing the symptoms of the high blood pressure and not necessarily dealing with the underlying cause. Often we hear this as well. My pain is gone, or the rash has gone away, but only too often then they'll tell us later that the problem reappears. And that's because the underlying cause of their problem has not been addressed.
I think a lot of the interest being generated and the demand for functional medicine arises from people who are just weary and wary of taking armfuls of meds. They just want to stay healthy, and they want to know how to do that from a very basic level and an individual level. I know, I hear, and you do too, patients complaining all the time about the advertising for drugs on television. That didn't used to be. And all of their warnings. It seems as if half the ads are telling us about the side effects of that drug.
You're absolutely right. People are looking for alternatives because they can be scared of the side effects that may arise from taking these drugs. Some of them can be pretty severe and even life-threatening.
Yeah. And Doc, I have another question for you, and maybe two out of that one. Do all chiropractors practice functional medicine? Is everyone qualified to do that? And what are the qualifications? I guess that's more to the point. Do you have to be qualified to do this?
Not all chiropractors practice functional medicine. Most chiropractors, I believe, will incorporate some of the ideas of functional medicine into their practice. For example, I know chiropractic has been espousing holistic and natural health care since its inception in 1895. It's interesting to see how all of a sudden we have this new healthcare field emerging when in fact chiropractic has been talking about this kind of stuff for decades and decades. But legally speaking, there is no licensure required by the state or on a federal level for someone to call themselves a functional medicine practitioner. However, there are a myriad of postgraduate courses available in medicine, in chiropractic, naturopathic medicine, that would allow a physician to learn the principles of functional medicine and to apply those principles within their practice. It's interesting to note that I noticed on the internet here recently that there is a medical school, and I'm sorry I can't remember the name of it, but a medical school that is offering postgraduate work in lifestyle medicine, which is exactly what functional medicine would be. So there is an upsurge in educational material available for practitioners to learn the principles of functional medicine so that they can apply those principles in their practice.
Interesting. Can we continue this discussion next week? I think maybe some specific issues would be very interesting to hear about.
Absolutely. I actually hope to spend the next couple of shows on this topic and talk about specific issues. And one more thing before we end. Chronic disease is a food and lifestyle-driven, environmental and genetics-influenced phenomenon. New approaches to management and prevention are required if we are to slow this rising tide of chronic diseases. By the way, just think of how many deaths are caused by chronic disease, heart disease, the end game of diabetes, autoimmune disease. These things are causing deaths at an alarming rate. However, this chronic disease explosion can be conquered by integrating what we know about the human body and then applying an individualized, patient-centered, science-based treatment plan that addresses the underlying causes of chronic disease, which, as I said earlier, are rooted in lifestyle choices, environmental exposures, and genetic influences. This is exactly what functional medicine does and is indeed a healthcare system appropriate for the challenges we face in the 21st century. Okay, now for the tip of the week. How many weekend warriors do we have out there? You know, the guys and gals that roll their ankles or injure their shoulder or their elbows playing golf or tennis or running or jogging. That happens all the time.
Yep.
Let's just clarify and make sure everybody knows the way to treat these strains and sprains is by the acronym RICE. The R is rest, the I is ice, and the C is compression, and the E is elevation. So the next time you get an injury as a weekend warrior, remember the acronym RICE. It'll help you get through that sprain much more quickly.
Does that mean you're going to be helping this wounded warrior this weekend? How about some vacuuming and some laundry and mopping? And
I don't think that's
I need to rest.
I don't think that's in the RICE acronym, but I'm sure I'll get roped into doing something like that.
We'll be chit-chatting. Well, that about wraps it up for another edition of the Chiropractic Corner. Again, thank you for joining us and for all of your input. Dr. Volstad and I would like to thank you for listening, and don't forget to let us know what questions you may have for Doc or topics you'd like to learn more about by emailing us at I am as in Mary, CHIRO, the number 1, at gmail.com, or by calling our office at 746-4242. We're located at 275 Tony Penna Drive, Suite 12, right here in Jupiter. We'd love to hear from you. Google Volstad Chiropractic to find our website for more information about our office or to listen to archived programs from the Chiropractic Corner. And coming soon, our show bloopers. For those on Facebook, please search and find our Facebook page and give us a like. We post a lot of information about healthcare and natural remedies that you can use at home. Join us next weekend for another edition of the Chiropractic Corner, right here on WJUP The Jupe, 103.9 FM, Saturday and Sunday mornings right after the 10:30 a.m. news. Until then, be well, live well. We'll see you next week.